Welcome back to TV5 News at 9. Today we are talking about cataracts. Joining us this morning is Dr. David Krebs. Thank you so much for being here.
Thanks for having me.
So what is a cataract and who gets them?
Well, a cataract is when the lens in the eye gets cloudy, and everybody gets cataracts as they get older. That's how the lens ages.
Okay, so what are the surgical options for someone diagnosed with cataracts?
Well, if the cataract doesn't bother you, we don't do anything. We just watch you until the cataract gets bad enough that it interferes with your daily activities. When the cataracts get bad enough and interfere with your daily activities, then we talk about your options, which is to either live with them or have them removed surgically.
I guess, what is it like to live with a cataract without getting it removed?
Well, if the cataract is small and it's not affecting your daily activities, you can wait till they get bad enough to do something about it.
Do you have any advice for when they're bad enough to get that surgery?
Well, when we recommend seeing people once a year with cataracts, and we ask you questions like, do they interfere with your daily activities? Do you have a hard time reading or driving or watching TV? And if the answer is no, I can read and drive and watch TV and do everything I need to do, then we don't do anything about them. But if you say, yes, I'm having a hard time driving, yes, I'm having a hard time watching television, then removing them surgically is an option for you.
Okay, so talk to us a little bit about laser cataract surgery.
Okay, so regular cataract surgery takes about 10 minutes. It's an outpatient surgery. You come in, you have the surgery, and you go home the same day. There's a new laser out. It's not that new. It's been out for about 5 years. It's called the LensX laser. And what the laser does is it's kind of like you've heard about robotic surgery for orthopedic surgery, things like that. What the laser does is it makes some cuts in the cornea to decrease people's astigmatism, and it's just more precise by laser than we can be by hand.
And do you need to use glasses after cataract surgery?
That's a good question. So that depends upon your choice of lens. If you pick a lens that's a monofocal lens, then you'll see good for distance, but you'll need glasses for up close. If you choose a bifocal or a trifocal lens, then there's a good chance you'll be spectacle-free after cataract surgery.
This is great information. And for someone who's interested, is it covered by insurance? I think that's a big question for people.
So the cataract surgery portion is covered by insurance. Insurance pays for cataract surgery. What insurance doesn't pay for are the special upgrades. So the two upgrades that you can get that aren't covered by insurance are the LensX laser or a bifocal or trifocal lens. Any of the premium lenses or the laser is not covered, but the regular conventional cataract surgery is covered. And if you have the laser cataract surgery, then a portion of it is covered, but not the laser portion.
Good to know. And thank you so much for taking the time to speak with us this morning about this.
My pleasure. Thanks for having me on.
And if you would like any more information, you can find it in the hot link section of WNEM.com.